how seriously can you take yourself if you're dealing with dick all day?
I just pee this way. Sometimes something just veers off to the side and I'm like, what the hell is that about?
If you were to take a hose and plug up the hose, it's going to spray all over the place. If you have a prostate that's blocking that flow, it's going to cause a sprayed stream.
Do you do anything with men or help them get better at breathing?
Doing HIIT exercise was shown to increase time to ejaculation, sort of like what people describe as edging.
I'm already done.
What exactly is squirting?
It's a large amount of clear, odorless fluid. That's typically called a squirt. You can also have an ejaculate. You're getting like a whitish, little, small amount of fluid. That's female ejaculate. Another study did ultrasounds of the bladder. So they scanned their bladder before they had sex.
People really trying to get to the bottom
People
of that.
really
I love
want to get, and then they had sex and they scanned their bladder and the
One of
bladder.
the great mysteries of the world, yo.
All right, so I'm super confused, about the streams. I try to pee
Like
straight.
rivers? No, okay.
Yeah, just like the toilet. Like you're in front of the toilet, you're like, I know if I aim this way, the trajectory, it's been the same for many years. I'll just pee this way. It's almost all of it's going to go in the toilet. Maybe there'll be some splash or something, but sometimes something just veers off to the side. And I'm like, what the hell is that about?
What is that?
Yeah. It's
So
a
we
real
brought you all
problem.
the way from Long Beach to explain this to us today on this podcast.
Yeah, well, I'm excited to be here. So basically, when you have a urinary stream, most of the time it should go straight. But obviously, as you guys know, this is not always the case. Now, there's a few reasons this happens. One is as you age, your prostate gets bigger. So the prostate is a walnut-shaped gland. It sits above the urethra or the P tube and behind the bladder. So it's like around the urethra, below the bladder, and it can block the flow. And so you're thinking about if you were to take a hose and plug up the hose, it's going to spray all over the place, right? It's not going to go in a straight stream. So very similarly, if you have a prostate that's blocking that flow, it's going to cause a sprayed stream. So that's one cause. It's very, very common. BPH is extremely common, or enlarged prostate. And this happens if you look at men in their 80s, almost 80% of guys will have an enlarged prostate. That doesn't mean they have cancer, it just means that they have an enlarged prostate. And so because of that, a lot of guys are going to have an enlarged prostate at 40 or 50 or 60 years old, and they're going to start having those symptoms. If you're younger than that, you can still have an enlarged prostate, but sometimes you'll have a stricture, like a narrowing of the P tube. Now that can happen from a trauma. Like some guys will say, oh yeah, I remember I had a trauma during sex maybe, or maybe something, I fell on something like a bike.
Sex injury.
Sex injury,
Be
yeah.
careful with those.
Yeah.
That's where my meniscus on that was.
Oh yeah, I remember.
I forgot.
I mean, I wasn't there,
Yeah,
but I
it
remember.
sucked.
I remember you telling us a story about it.
that was not. Shame on me. Keep on. I'm sorry.
There's no
All
shame.
the sports
There's
you
no
played,
shame.
all the
But
dangerous-
Actually, it
there's
was
no shame.
quite embarrassing. I got out of the bed and I went in my knee, and then I couldn't walk.
But I mean,
Yeah.
It's shameful.
it's shame on your knee. But if you did it again, then it would be shame on you.
True. True.
Yeah. Probably you had a good time.
Yeah. Can't even remember, right? So wasn't that great?
He just remembers the injury.
So, and then, I'm sure you guys all know this, but when you have some semen left in the urethra or the P tube, that is also going to act like a blockage, and then it's going to make it spray all over the place. So there's a lot of different reasons it can happen.
That's why you sit afterwards.
Yes. Yes. You want to keep a clean seat, especially if you're at...
Oh yeah, do we sit or do we stand?
Great question. Great question. So did you know that I think it's Germany, that the large majority of men sit and they don't stand? So it's not a universal thing that people stand to pee, or men particularly. And so why, right? The reason being is that some people find that when they sit, they can, one, relax their pelvic floor, which is the muscles that sit underneath the bladder and urethra. And so that allows their pee stream to be a little better. Two, they can even lean forward a little bit. So they're adding a little abdominal pressure onto their bladder so the pee comes out more easily. So for some people, they find it that it actually helps them pee, especially
And
if they
three,
have...
you can get on your phone.
You can.
Send a quick text message.
Downside.
But usually it doesn't end up being a quick thing.
Yeah,
so you don't want to
right.
sit on the toilet for
That's
too long,
true.
right?
Legs fall asleep.
Yeah. Yeah. So then, that's why some people sit. So it helps their stream be a little better and they don't make a mess. But if you're fine standing, there's no better way to pee. It's whatever you feel comfortable with, unless you're having trouble emptying your bladder, in which case then sit and see if you empty it a little better. And that may be a reason to do so.
I find that when I sit, because whether it's in the middle of the night or my son chases me into the bathroom, and you know, if I try standing up, he's like, "Cool, water fountain," and I'm like, "No, it's not cool, bro. Don't do that." But when I sit down, it's almost like, "Oh, no, check this out." He'll do this too. He'll look. He'll be like, "It's big."
I remember doing that to my dad when I was younger. I was like, "Dad, why is yours?" And then he left soon after. True story.
Damn it, Nsima. So back to what I was saying. When I sit though, it's like I can kind of pee forever. It's sort of like, all right, I guess I'll get up now. But I feel like it's just like never ending. Is that just because I'm like always storing more pee, or is it just, I don't know, they got something else going on there?
Well, it could be that if you are sitting, is your stream the same? Like in terms of strength of stream when you stand and sit?
Like initially, yes, but then towards the end, it's just like kind of, you know, I guess I'll say dribbles.
Yeah. So I mean, it may be that you're not completely emptying when you stand, and then when you sit, you can empty a little better.
Okay.
And so that sometimes happens. Sometimes we'll tell guys who are having trouble peeing is to go twice. So like maybe stand and then walk away, like do a little walk around the bathroom and then sit down and pee again, and you might get a little bit more.
I have a question, Rena. Being a urologist, do you run into men that have a problem with relaxing their pelvic floor? And why would that potentially be an issue if a man has an issue with that?
Absolutely. So that is a very underdiagnosed, underrecognized problem, but I see it all the time. And so what happens is, man or woman, we all have a pelvic floor. Pelvic floor is this bowl of muscles that sits there. It has a lot of functions. It helps us walk. It keeps us stable when walking, keeps our organs up and in the right place. Mm-hmm. It helps with, you know, when we take a breath, when we take an inhale and exhale, we're activating our pelvic floor. We're using it all the time. And so just like people get TMJ, like when they're sleeping and they clench their jaw at night, they have no idea they're doing it, but they wake up with a headache, right? Same thing, you can do that to your pelvic floor. And why does that happen, right? Stress is very common cause. Anxiety, type A personalities who are just really busy doing a lot. Trauma in the past can sometimes cause this. Sometimes you might have had a specific event that caused it, right? Like maybe you had, like for women, childbirth, sometimes they'll have that, or you've had surgery and then your pelvic floor tenses up because of pain, right? And it's responding to that. And so I describe it a lot like as if you were doing bicep curls, right? A normal bicep curl, you're taking the full range of motion. But when you have a bicep curl that's in your arm is stuck like this, now you can't do a full range of motion, right? And it hurts a little bit. And maybe not just your bicep hurts, but your shoulder hurts, your elbow hurts, your wrist hurts, right? So you're going to have pain or potentially dysfunction in multiple areas. So how it can present is so variable person to person. It can present as back pain, hip pain, urinary frequency or urgency, like going to the bathroom a lot or having to rush to the bathroom, constipation, erectile dysfunction, because when the muscles are too tight, right? Blood flow is not getting through as well. And so then you can have difficulties with erections. You can have pain with erections, pain with ejaculation, even testicular pain. So sort of a whole host of different symptoms. And some people will just have one. They might just have constipation, or they might just have urinary symptoms, or they might have a whole host of symptoms. But usually when you dig deep, you'll find something that, oh, this happened when I started being really stressed at work, or I was sitting a lot. During COVID, we saw a lot of it. People were sitting all day long, which is great. We're not sitting today, right? We're not stressing. We're not shortening our pelvic floor by sitting all day. And so that's a problem. When you're not moving, you're not stretching your pelvic floor regularly and using the full range of motion, then it can get tense.
Yeah. And in your example of like the bicep curl, what I think the way that a lot of parts of the body work is if you have to flex them and tense them a lot, like to say like hold your pee, you're kind of in a compromised spot. And what I've found is getting a little older, it gets harder to hold your pee. That's the same way that you did when you were younger. And what I've learned is like, I need to actually relax and not flex. Like if I flex harder, it makes it worse. Or if I try to, you have to sort of distract yourself a little bit, but then also you need to at some point relax. Mm-hmm. Then you relax and it's way easier to hold your urine.
Yeah, sometimes if you think about like if you're taking a hot bath, like you're submerged in some warm water, you're like, oh, I feel like peeing. Like your muscles are all relaxed and sometimes the pee flows better. You're like, God, I'm in a bath. That sucks. It's annoying. But like, it does help relax the pelvic floor. Mm-hmm. So sometimes I'll tell like anyone with pelvic floor dysfunction, take a warm bath, 20 minutes a day. Take a warm bath. It's going to help stretch and relax those muscles. And so that's really helpful. And then, doing things that stretch and lengthen those muscles. So like yoga poses, like happy baby pose and and child's pose or doing like deep low squats. Those are all going to stretch and lengthen those muscles.
What about maybe some like myofascial release type stuff, like getting into the gut smashing? And I even saw one woman was talking about using a tennis ball, and you like sit on the tennis ball and you basically put the tennis ball on your taint. I don't know if you've ever seen anything like that.
Yeah, absolutely. So you're basically, those are all great ways. So when you go to a pelvic floor physical therapist, say you have real dysfunction, they'll actually do myofascial release with you, and they'll figure out where the tension is, because the pelvic floor
Human
muscles
Garage, shout out.
there's
Do you know Human Garage? No? Okay.
No.
They're great.
Yeah.
Yeah.
So there's
A lot of butt stuff.
The pelvic floor muscles, how you access them is through the butt, right? Through the rectum. And so when you go to a pelvic floor physical therapist, they'll work on different ways to help one, identify where your trigger points or your tension points are. And they'll teach you how to do exercises that target those areas. For some people, it might be lower abdominal muscles or, in the hip area or something external, like
You
in
go
the
to the
perineum.
doctor and like, we got to go through your butt. You're like, wait, what?
Yeah, I mean, so that's a whole nother topic, but we do rectal exams, right? And we do them for prostates to examine the prostate. Now, there's a lot of discussion about, is this necessary, right? Do we need to examine the prostate? We now have blood tests that screen for prostate cancer. And you asked me this earlier, like, is that all you need for prostate cancer screening? And probably, right? Like there's 3% of cancers, prostate cancers, that don't emit a PSA, but the large majority of prostate cancers will. So doing a prostate exam is good to test for detection, but that's not the only reason that urologist does a prostate exam. We do it to assess the size of your prostate. And then also, if you have a good urologist who understands the pelvic floor, they'll also examine the pelvic floor and see if you have tension in those muscles, or if sometimes palpating those muscles causes your symptoms to recur. So sometimes we'll palpate those muscles and be like, I feel like I got to pee. Or, I feel pain. And so we'll be able to tell where exactly the tension is, and then we can refer you to a physical therapist to help you work through that.
And a cool deep cut for all the podcast listeners. If you're new to the podcast, we did a podcast with this guy named Gil Headley. He's worked with probably the most cadavers than anybody, right? And one thing he's noticed with the fascia there is like a lot of people are very tight, because a lot of people, when pooping, they're pushing rather than relaxing. So there's something there. You guys can check that out. But I also have a question about pelvic floor dysfunction. And is there any link between that and premature ejaculation for men?
Yeah, so certainly they're all interconnected, right? So premature ejaculation, for just to sort of define what it is ejaculation before you or your partner desires. Now you can have it lifelong or you can get it. Very often it's sort of a combination of things, but more often it's due to the sense you're becoming more sensitive to sensation that's particularly at the head of the penis. That's where we think that it's coming from, that like sensation that's quite strong at the head of the penis will then, because ejaculation is a spinal cord reflex. So that sensation gets sent to the spinal cord and gives you a sensation, as you may all know, when you're about to ejaculate, you feel this like sense of it's coming and I can't stop, right? And so that's not something under your control, but to kind of manage the sensation and manage your focus around the sensation and then do things like that can be very helpful. So things like stop-start technique, which is where you get to the point almost of climax and then you stop. And then you have your partner grab the penis and like sort of stop, and then you restart again. Sort of like what people describe as edging.
I'm already done. I'm out.
You finished?
Count me out. Yeah.
No self-control, eh?
No.
It's just gotta...
Nope.
Yeah. Those things can be used to help with training that. But then when you do that to excess, so sometimes when people are edging over and over and over again, that can actually lead to pelvic floor dysfunction, right? Because you're tensing your pelvic floor to hold it back from climaxing, right? And so then if you're doing that all the time, and say you're like, some people are like masturbating and edging for hours, right? Then they're going to...
Taking me back to my teenage years.
You can develop some pelvic floor dysfunction because of it. And so it's more so that it could be a sequelae, and then of course it's contributing to things. But usually it's more of like a sensory thing.
Can I ask you this also? When it does come to that and men, do you do anything with men or help them get better at breathing? Because one thing you notice with a lot of people is they're very, and then take that to sex and you're excited. It's going to be likely that, I don't know,
Yeah. So a lot of you basically want to work at reducing your sympathetic nervous system, right?
Yeah.
That's in overdrive when you are, having sex, obviously, but also in premature, people who have premature ejaculation, their sympathetic nervous system is overdrive. So some of the things that we do are to try to reduce that, to sort of balance your sympathetic and your parasympathetic nervous system. So for example, diaphragmatic breathing can be really helpful. But I actually read a few interesting studies recently on exercise. And so doing HIIT exercise, so high intensity interval training for 7 minutes for 14 days was shown to increase time to ejaculation, or what we call intravaginal ejaculatory latency. And so that because you're now more, one, they think it's balancing the nervous systems, but two, you're really focused on something for for those 1 minute or 30-second intervals. And so your body's getting used to being really aware of where it is in time and space.
Yeah.
And then also you're being really focused and sort of mindful, right?
Mm-hmm.
And so that is actually translating to improvements in the bedroom.
And then also, I think a cool thing, I've never read this study, but doing a lot of HIIT, I do a lot of sprints, you become better at, you finish a sprint or you finish some HIIT, you get better at bringing your heart rate down so that you can do the next one after you've done it for a while. Yeah. So you can just imagine how that can apply to the bedroom. That makes sense.
Absolutely.
I think it's important to discuss overtraining. I think that a lot of us get into a situation where we can handle quite a bit. We can lift and run and do jujitsu and do a lot of these things. But then, your lady hits you up when you go home and you're like, oh, I can't do what I want to do tonight. And I think, if people are being honest, I do believe a lot of men have run into that. I know I've had many discussions with people in the past. And so training is great because it can do so many things, right? But this idea of overtraining, we got to be pretty cautious of that.
Absolutely. So one, obviously fatigue, right? Anyone who's tired, you're not going to want to have sex, right? You have to decide between restoring your body and giving it the sleep it needs to be able to do the things it needs to do the next day, or having sex. And sometimes that will, the balance will go towards sleep. But also, if you think about testosterone in men, right, it goes through a cycle. So in the morning it's high, and then it starts to drop, and it goes in like a little bit of a bump, and then it goes down again. It starts replenishing overnight. So not only have you now overtrained, and that may affect your testosterone because as you put more stress on the body, you have more cortisol release, and your testosterone then responds by going lower. So that's one way. And then two, it's late in the day, right? So your testosterone's at its potentially lowest. And then you're like, oh, so that's the hormone of desire. And so if your hormone is low and you're not having as much desire and you're tired and you're stressed, your body is stressed, all those things together are going to make it so that maybe you're not going to have the energy to have sex. And so I think it's really important to sort of figure out that balanced spot where you're training, but you're obviously still have energy. I mean, obviously you're going to feel fatigued, but you want to still be able to do the things that you want to do. And so it's really tough, I think, to figure that out. And maybe you guys have some tips on that, on how to really dial in so that you're not stressing your body out so much that it's causing the negative effects of overtraining.
I think we have a lot of ways to train that, aren't super stressful. Like for me, I like to walk a lot. I do run, but I also have shortened the amount of time that I'm running. The frequency, you got like frequency, duration, intensity. So these are all things that if you're paying attention to them, you should still be okay from an energy production standpoint and still be able to do a lot of the things that you enjoy and that you love. But you should also just be aware, like if you go out for a 2-mile run, the odds of you being able to do, and you're my age, you being able to do something you did in your 20s in the bedroom is probably less likely to happen for that particular day. And so you might have to just kind of account for that. And you have to try to account for, how much do you want this other goal and how much do you want these other things to be part of your life?
Yeah. And go ahead.
Go ahead.
Well, I think physical stress, but also mental stress, right? Like I think we, a lot of us are high performers. We're working hard. We're mentally strained and taxed. And that also plays a role. And I think the one point you bring up is running, right? So cardiovascular, high, like aerobic exercises are the ones that are going to increase your cortisol the most. So you want to do those. Obviously, you want to at least at a minimum be getting 150 minutes of that per week. But, in terms of like overdoing it, where we see low testosterone often is like ultra marathoners, like really high intensity performers who do primarily cardiovascular exercises. And so not that they're bad, but they are the ones that can cause harm to your hormones if you're overtraining.
One thing I do want to add on actually with what you mentioned in terms of recovering better, and you've mentioned this many times too, is learning how to nasal breathe during exercise, because inherently when somebody gets better at that, they're going to start breathing more into their diaphragm. But one thing that also ends up, I think would be very good for guys in the gym is learning how to breathe through all of their exercises. Mm-hmm. What tends to happen is when you're trying to build muscle, you will, even when you're doing a bicep curl, when you're doing a squat, everything is holding of the breath. But when you start to do actual sports like jiu-jitsu or basketball or running, when are you ever holding your breath? You're breathing through the whole thing. Now, I think guys can relate to this. When you want to come really fast during sex, what do? You hold your breath a little bit and bam. But I think a lot of guys are probably doing that inherently when they get excited. They're just holding their breath. And then what happens? You nut a little bit earlier than you want to.
Yeah.
So it's a big concept, but just learning how to breathe during all of your exercise, even your lifting, can go a very, very long way in helping you recover faster, because you're not tensing yourself up so much. So you're going to recover faster, but then also it's going to pass into other ways, other things you do in life.
Yeah. And it's also really important for your pelvic floor. So, you know why you guys, bodybuilders, personal trainers, everyone's always going to tell you exhale on exertion, right? The reason being is because when you exhale, you activate your pelvic floor, you stabilize it so that you can actually do the activity that you're doing. And so if you are constantly most often it's breath holding, right? If you're breath holding all the time, you're going to develop pelvic floor dysfunction. So we'll see, bodybuilders really like people who do a ton of lifting with pelvic floor dysfunction because they're not breathing. And so it's really important. Like I find myself like, breathe. I tell my son, we work out, I'm like, breathe. Like, don't hold your breath. Like, we have to work on it. It's hard. Your natural intention, your natural idea is to hold your breath because it'll help you push more, right? You actually have to make a thoughtful effort to keep breathing.
And then end of your breath is the end of your range of motion. So I want people to think about that the next time they wake up in the morning and they're picking up their socks or whatever's on the floor. When they go to bend down, they're going to go, huh, probably a lot of times. So you want to try to think about that. And instead, you can breathe your way through that, or you can just work on, there's a lot of ways you can kind of work on that. Like for myself, I've actually thought of, instead of like bending down and thinking about my back and my hamstrings, I actually just think of my quads, my shins, and my abs. And I actually go down to the ground faster. And I just try to breathe through it, which sounds silly. I know like we're talking about like picking up something that doesn't weigh anything off the ground. But sometimes in the morning, like your body is a little stiff. But also doing the rope flow stuff has been really helpful as well. And we showed you a little bit of that. We'll do more of that later today. I think it's important for individuals to find activities that can be done with a pretty good duration, but they don't cost you much of anything. And that's where something like walking is really good. This rope flow is going to be really good. Walking with a weighted vest, like activities that are like just not super stressful. And then also picking and choosing appropriate times of the day. Like in the summertime, a lot of times I'll run like right in the middle of the highest heat, it'll be 100-something degrees. And that's on purpose to test myself sometimes. But I also have to recognize that is a very stressful environment. It's 104 degrees. I'm running for an hour. And that is going to cause a cascade of bad hormones in a way. Sometimes it's good to have some of those, quote unquote, bad hormones because Mother Nature doesn't make any mistakes. There are no bad hormones probably. So it's good to have a little bit of kind of back and forth with your training. But the main thing is to have things that are simple, easy to do, that you can do frequently, that don't cost your body that much.
We talk about physical performance so much and how important it is to be healthy. But how about your sexual performance? And I'm being serious. So for all the guys in here, being real, sometimes you're just a little bit stressed. Maybe you didn't get much sleep. Blood flow doesn't work the way it should. You go in and it's time for some fun and this is what you're working with. Whereas this is what you should be working with. That's why we've partnered with Joy Mode. And I'm being serious here because Joy Mode has ingredients within their product that is going to massively help with blood flow. And we know that if you want to be working with something that doesn't have any give to it, you need good blood flow into your manhood. All right. The ingredients on Joy Mode are as follows: vitamin C, citrulline, arginine nitrate, Panax ginseng root. This is legit stuff mixed into easy packets that you can pour in a drink, and 30 minutes later, your blood's going to be flowing like it should. So Andrew, where can they get it?
Yes, that's over at usejoymode.com, and at checkout, use promo code POWERPROJECT to save 20% off your entire order. Again, usejoymode.com, links in the description as well as the podcast show notes. Damn it.
Oh, shit.
Yeah. And occasionally stress it, right? If you want to grow, you're going to have to stress yourself out. So we don't want you to always play it safe. But I think in terms of like balancing that out, right? It's a balancing act and just figuring out things that are easy that you can incorporate in your day-to-day routine that don't end up like really being so stressful that you're like, I don't want to do it, right? Like you should have, if you're constantly pushing yourself to lift or go to failure every single day, like you're not going to do it for a long period of time because you're going to burn out.
I have a question for you. Again, you see so many men and women, and I know it's coming to the breathing thing, but within fitness, everyone wants to keep their stomach tight and flat. So when you see that, what other things do you see from there when people are just, everything is trying to keep their abs tight?
Yeah. So actually it can be really harmful to constantly suck in your abdominal muscles because then again, this is all part of your core, right? The pelvic floor muscles and the abs and your back muscles are all part of your core. And so when you tense one part all the time, you're going to create dysfunction in other parts. So I have one patient that comes to mind who has really tense abdominal muscles and he has really bad overactive bladder. Like he's going to the bathroom all the time, urgency, frequency. It's ruining his life. And so we work a lot on trying to down regulate those muscles.
And we're talking about energy. I think for your significant other, it'd be a good idea for people to think about how to make your significant other's day a little easier. So, men are always like, well, what does having sex have to do with doing dishes? But there's somebody recently, the video went viral. I'm not sure which actress it was, but she was like, my husband does the dishes, he's getting a blowjob. And I was like, damn, like a lot of people saw that and were like, shit, that's all I got to do? Maybe I'll start doing some dishes. But taking some workload from each other, I think can be something that can really be helpful in the bedroom as well.
Absolutely. And, I think a lot of people, there's a few things here we need to touch on, but I think one is that when women look at sex, they look at sex as another stressor, something they have to do, not as something they're going to do for stress relief, whereas men tend to look at sex as more of a stress relief activity. So if a female partner has a lot on their plate, like they're working, they're taking care of the kids, maybe they're taking care of their parents too, they're helping out with their parents, they're doing a lot. And they come home and then they got to do the dishes, do the laundry, whatever else there is. If you can help alleviate some of that stress, that is a huge gift, right? That's a huge gift that you're giving to your partner. And that allows them to get in the mindset to then be able to receive pleasure, right? Because when they're tired and stressed, they don't want to have pleasure. So if you can alleviate stress, that's going to be really, really helpful for your partner. And I think it's hard for guys to see that sometimes. Like, why would as you mentioned, why would doing dishes or helping with laundry make any difference? But it really does, right? And so I think, especially when it comes unprompted, right? Like if you're like, hey, I did this for you, like not even saying anything, but just doing it, right? It can be really helpful. You see all those TikToks where like guys are vacuuming and like folding clothes and the woman's like, let's go to the bedroom right now. Like there's a reason those do really well on social media. And then the other thing is desire changes over lifetime, right? So when you're young, a lot of us have what's called spontaneous desire, which is what you see in the movies. And it's you see someone, you want to jump them, you want to have sex right away.
Knocking all the stuff off the table all the time.
Right. And like you have sex, you get together, you climax, it's done in like minutes, right? That's obviously not real life. But what happens is a lot of people develop what's called responsive desire. So what that means is like, let's say you go to the gym. You don't want to go to the gym, but you go. Once you're there, you're like, oh, I'm glad I went to the gym, right? Very similarly, when you are intimate with your partner and you are like, okay, let's just be intimate. Let's be together. Let's be close. Let's touch. Let's whatever. We're not focused on sex. We're focused on being together. And then you start receiving that. And then you're like, oh, now I remember that I used to like this. And now I have desire. And now I want to have sex. So the arousal comes first and the desire comes after. And that's completely normal. So sometimes it's how you approach your partner, right? Like, do you just approach them like roll over and in the bed,
Assume
like
the
I'm ready,
position.
right? Like I'm ready, and they know that's what you want. But maybe it's like, hey, we schedule time where we're going to be intimate, like we're going to be with each other. Sex may be on the table, maybe not, but the goal is to connect, not to have sex. And then they're like, oh yeah, I like this. Like, of course they like you. They chose you as a partner, right? They want to be with you. And so it's like, it's just reminding them of that. And then the desire comes, and then you can have great sex.
Let's make sure the dog is in the room and the 4-year-old kid, and make sure all that stuff plays into it too, right? And it's like trying to find appropriate times where some of that shit's not around, and it's hard. So it's difficult
really
to find the time sometimes.
Okay, on this topic, this is quite interesting because what you said is totally right. Over time, it's not going to be as spontaneous. But what if there is a partner that's like, I want the spontaneous aspect of our sex back, right? And they don't like the scheduling, like because you hear a lot about that, right? So what's the option? Because spontaneity isn't always there.
Yeah, I mean, I think you got to be open to both, right? So like, it can't be one or the other. You got to be open to both, because some people, like, let's be real, right? Especially you've got kids, you've got work, you've got stuff to do, and like we'll schedule time to go on a date, right? Sure, we'll go for a dinner, but like dinner is not sexy. Let's actually schedule time to be with each other, right? Yeah. Then have dinner. Sure, if you got time afterwards, go for dinner. Do all the stuff you want to do. Go for a movie, but like, be together. Like we're, especially nowadays, we're in our phones, we're doing so much stuff. Even in the evening when you get home with your partner, how much time do you spend interacting with them, right? So it's like really having that quality time, and then the spontaneity will come, right? Like you'll rediscover the affection and enjoyment you have in each other. And then, it may just come on its own, but like you have to get there. And then having some novelty is also really helpful. So like when you're in a long-term relationship, you have your script, you know what works, you know what's going to, get you both to come, and like, it's going to be great. But sometimes you need something new, because everyone gets bored a little bit, right? So it doesn't have to be like, you don't have to, go crazy unless that's your interest, right? But you can, it's simple as like having sex somewhere else. It can be as simple as, you can definitely bring toys to the bedroom. It can be as simple as role playing. But anything that can change it up a little bit can be very exciting for the other partner and you, right? Because you're doing something new with someone that you already enjoy. And so it can be really fun and make that idea of spontaneity even more appealing, because, hey, it's going to be different this time.
Some men think the toy will replace them. So, question, are the toys going to replace us all? Like, should we be worried about the toys?
No, not at all. So like, I think that the reason this is a concern, right, is like, let me put it to you this way. Do all your orgasms come from your partner? Right? Mark is shaking his head yes. Good for you, man.
Okay, let's go.
All right. Well, for a lot of people, that's not the case. And so very similarly, all a female's orgasms doesn't have to come from their partner, right? A toy is just a convenient way for them to climax. It's convenient, it's easy, it's accessible. It happens much quicker. So when you look on average, how long it takes for a female to climax in partnered sex is around 12 to 14 minutes. With a toy, 8 minutes. So a little faster, right? A little more convenient. It doesn't mean it's better. It's not doing anything else besides stimulating the genitals, right? Yeah. But we've also looked, there's actually been lots of studies looking at how women view toys, how that affects their sex life. And when a woman generally uses a toy to augment her sex life, meaning she's having a good relationship, she's satisfied in her relationship, she's happy with it, they're having sex, it just augments the relationship. It's just making their sex life better. They're actually having more sex with their partner rather than less. So it's actually like, if your partner's using a toy and you guys have sex, like she's probably going to have more sex with you, and it's probably going to be more fun. So really not going to replace you. But if you're having sex that's not great and you're not having fun with your partner, then they're going to choose something that's more convenient, right? So I think it really depends on your baseline relationship.
Gotcha.
In helping, so many people with like erectile dysfunction, helping people maybe with their hormones and stuff, have you seen like a split in like sexual appetite? So like you help someone with their hormones, maybe they lose a little bit of weight, they get in a little bit better shape. Maybe you find out they need TRT. Maybe they discover Cialis and some different interventions and they work really well. And you find out the partner is not as into it because the relationship hasn't been that way in the past.
Yeah. So I think it's important to treat the couple, right? Like to figure out what's going on in the bedroom, right? Like I always ask my men and my women, like, how does your partner feel about it? Like, what are they thinking? Have you talked to them about it? Because 9 times out of 10, probably more than 9 times out of 10, that the guy has, or the female has never brought it up, or they've tried to, and it's been a disaster. And so they don't know what the partner's thinking. And so I always encourage people to incorporate their partner in the discussion about what's going on, right? Of course, your partner wants you to feel good. But if they are maybe silently struggling with something else, like maybe they also have low libido, or maybe they're having pain, or maybe there's something else going on that they haven't brought up to you, then you might get your libido up and roaring. And then they're like, oh, wait, still don't want to have sex. And now you're frustrated, right? So I think it's really important to do that. But talking about what is the mismatch, it's very, very common that couples will have mismatch at some point in their relationship, okay? You're not always going to be having the same amount of desire all the time, right? That's great if that is the case, but it's very unlikely, right? Because life is a fluctuation. And so more commonly, we see women with low libido. About 40% of women, when you give them survey questionnaires, get low libido. Now, does that mean it's bothersome to them or their partner? Only about 12%, but still, that's a pretty high number. And again, I think when we talked about some of the reasons, it's really biopsychosocial. It could be a hormone issue, absolutely, but it also can be stressors in their life. It can be other mental aspects if they're suffering with depression or anxiety. It can be due to medications they're on, whether it's like antidepressants or even sometimes birth control pills can cause issues with desire. And so very rarely, I don't want to hate on birth control pills, but I think it can happen. And so I think ultimately there's a lot of factors that go into it, but we certainly see it more commonly in women. And fortunately now we do have a lot of things that we can offer them. There's always sex therapy. There's always sort of managing your stressors, and we got to fix the whole problem. But we also now have medications and off-label testosterone that we can give to women who are suffering from low libido that can often help with libido.
Is there other things that women can explore for, like I know that men have, Viagra, Cialis, and maybe some other things that you can tell us about in a little bit. But what about for females? Is there stuff that works really well?
Absolutely. So there's these 2 medications I was talking about. So flibanserin is a pill, or Addy. It's like the little pink pill. You take it once every night before bedtime. And over time, after about 3 months, you'll start seeing an increase in desire. So it's very subtle. It's not this like, oh my God, I see you, I want to rip off your clothes. It's more like, hey, I didn't used to find this person attractive, and now I'm looking at the TV and I'm turned on, right? And I never used to feel that way before. Or I'm doing the dishes and all of a sudden I sort of feel this desire to have sex. I never thought of that before. So really subtle changes, and it takes time. But it does work in about 40 to 60% of women. So it is a great option for women. The other one is called Vyleesi, which is also used off-label for men. Many people talk about it, called bremelanotide, or PT141 is the other term that people use for it. It's an injectable medication. You use it 45 minutes before you want to have sex, and it gives you a very sudden, strong desire for sex. Now, this does have some side effects. Nausea is very, very common. About 40% of people will have nausea. So I give them an anti-nausea medication to take at the same time, because the last thing you want is to be nauseous and horny. That's not great. But it does work pretty well. So those are a couple medications that we have. I mentioned off-label testosterone. We're now checking, when women come in, we'll often check testosterone. The more I check, the more I see that women have low testosterone. For women, women actually have more testosterone in their bodies than estrogen. And it's also a hormone for desire in women. It's also good for muscle growth. It's also good for all the same things it's good for men for, right? And so when it's low and you replace it, oftentimes you will see an improvement in libido, as well as sometimes mood, sometimes muscle growth if they're working out. All those things can be beneficial with taking on-label testosterone, off-label testosterone. It's 1/10 of the dose of the guy. So you can you can even prescribe just androgel, which is male topical testosterone. They can take put it in a syringe and take 1/2 cc of it every single day and rub it on their thigh, and they're good to go. So those are sort of things that we use for libido. Now, the medications you mentioned, like tadalafil and sildenafil, those are used for arousal, right? They're used so men have erections, women's have clitorises that get too messed. So just like a guy's penis gets long and hard, women's clitoris gets long and wide and hard, right? You can't see it. It's mostly internal. There's a little bit external, but very similarly, the same thing is happening. So if they're noticing a decrease in arousal, so maybe they're not getting that pressure feeling feeling, that can help with that. Now, the other part of arousal is often lubrication. Right. And so what happens if lubrication goes down? Very commonly happens all the time when women are going through perimenopause and menopause and postmenopause, right? This is because your estrogen decreases and then you're not making as much lubrication. So what can you do for that? So obviously you can use lubricants. There's great lubricants available over the counter. You can use moisturizers, which are like hyaluronic acid based, just like people use moisturizers for their face. They use it for their vagina, put it on every day. Those are great too. And then if you want to treat the issue, you can use vaginal hormones, vaginal estrogen or vaginal DHEA, which can then cause an increase in lubrication and also kind of keep the tissues thick and elastic and flexible, because as they go through those changes, their vulva and their vagina are going to change. They're going to get thin. Their labia will shrink. Their clitoris might get smaller. The foreskin of their clitoris may also shrink a little bit. And so we're trying to keep those tissues healthy, pink, and supple. And so that's going to help treat that.
On the topic of lubrication, we've, first off, this is going to be a two-parter. What exactly is squirting? And we've had multiple people on the podcast mention that every woman can squirt. Is that true? Is that
the goal?
Is that a goal?
Yeah, good question. Yeah, so squirting is very controversial because they've done a couple studies on this, right? They've looked at squirting. They've actually taken like samples of squirt.
Who's doing these studies? Who's looking at this?
Yeah, so there's some academic researchers who've actually taken samples of squirt and they've looked at it and said, what is it made up of? And so one study looked at it and said, it's like a dilute urine, but it also has PSA in it. So PSA is, you guys commonly know of as something we test for prostate cancer, right? It's prostate-specific antigen. But women don't have a prostate gland, right? But in fact, they do. It's called the Skene's gland. And it's actually where people describe the G-spot. It's actually a zone. The G zone is where you have these Skene's glands, the duct-like glands that are sitting underneath the urethra that also have some fluid. Now, they don't have a ton of fluid. They have like 1 to 5 cc's probably of fluid, not a lot. And so when that's stimulated and you have a climax, you're going to have some fluid come out. And that's typically squirting. Now, if it's a large amount of clear, odorless fluid, that's typically called a squirt. You can also have an ejaculate, which is probably primarily from the Skene's gland. You're getting like a whitish, little small amount of fluid. That's female ejaculate. And then obviously there's lubrication. There's different kinds of fluid. So this is where the flaw is with these studies, like what fluid are you really testing, right? So then there's been a couple studies that have actually looked at like what is coming out, right? So there's one study where they put blue dye into the bladder and then they had them squirt and then they saw the blue dye come out. So like, oh, it's urine. Okay, we know it's urine. Another study did ultrasounds of the bladder. So they scanned their bladder before they had sex.
People really trying to get to the bottom.
People really want to get. And then they had sex and they scanned their bladder and the bladder.
One of the great mysteries of the world, yo.
Well, look, I mean, everyone's interested, right?
Yeah.
And then they're seeing that the bladder's empty, right? So clearly it has to come from the bladder because that's where you're going to get the most fluid from if you're squirting a large amount of fluid, right? But is it urine, right? Is it the exact same thing as urine? So there's a couple theories behind this, right? Because a lot of people are like, well, I pee right before sex and then I squirt. And like, how is this happening, right? But some people are probably getting a lot of fluid in their bladder before they have sex. And then maybe they're having a strong contraction. And sometimes you can have leakage of urine when you climax if you have a weak pelvic floor. So it really depends on like how you define squirting, right? But there's one guy who was on my podcast, Dr. Barry Komisarek, who's really thought about this a lot. He does a lot of research on MRIs and orgasm, and he said he thinks there's something like imbibation, where when you give rats estrogen, what happens is their organs swell with fluid. And then when they climax, those organs contract and squeeze and that fluid comes out. So maybe there's a theory that the bladder wall is filling with that, fluid and then it
How
contracts.
did he test these rats? That's the first thing that came to mind.
Some wild shit going on.
Yeah, I don't know the specifics of that study, but this is his theory. And then of course this is just urine. Regardless of what it is, right? It doesn't really matter what it is.
It's cool either way.
I think, it can be really fun for some people, but interestingly, when you ask women how they feel about squirting, and this study has been done too, where they've asked women and they've said, how do you feel about it? So some were like, it's great. It's a superpower. I feel amazing that I can squirt. But there's also some women who are like, this is a big mess. And I'm embarrassed and I don't actually like it, right? And I don't know what it is and it makes me uncomfortable. And so I think like for guys, it's like this is the only visual of an of pleasure and climax, right? So for guys, it's really fun. Like, oh, I see a squirt. I know she's climaxing. I know she's
Just
feeling
get a
great,
poncho.
right? And then, but ultimately, that's not the only visual. So you guys will know this from having sex, right? That when a woman climaxes, her pelvic floor will contract at a rate. Like it'll contract about every 0.7, 0.8 seconds. So you'll actually feel those rhythmic contractions, or you'll see them because you'll actually have those contractions. So that's, one way that you can get that feedback. But ultimately, like squirting, could people do it? Sure. I'm sure if you fill your bladder and you stimulate the G-spot, some people may be able to force a squirt, but like, what's the goal, right? The goal is pleasure. The goal is climax. The goal is having fun. And if squirting's part of it for you, great. And if it's not, that's okay, right? It's completely fine as long as you're having fun and you're having pleasure.
Someone wants me to ask this question. Where is the G-spot?
So the G-spot is actually a zone. As I mentioned, there's no
Zone.
like button. There's no magic place that you're going to touch. It's 2 to 3 centimeters in at the top of the vagina. So you put your finger at the top and do like a come hither motion and you're going to hit it, right? And so that is sort of where the G zone is. And again, this is where the Skene's glands are. And those are like the male prostate. So like some guys enjoy prostate play, right? They may feel that that is pleasurable. Very similarly, some women will find that that's pleasurable, but it doesn't mean that every woman is going to climax from that stimulation, right? Because not every guy is going to have an orgasm from prostate stimulation. So it's sort of analogous to that, but it is pleasurable. It can be enjoyable. It's going to a different nerve ending than the clitoris, right? So when you think about how women climax or from what stimulation women climax from, clitoral is the most common, most reliable, easy way for women to climax. 85% of women need clitoral stimulation to climax. They're not going to climax any other way. That's like somebody stimulating your penis, you're going to climax, right? Same thing, you stimulate a woman's clitoris, she's going to climax. G-spot, some women climax from that, and some women climax from stimulation around the cervix, which is at the very top of the vagina, but not everyone does. And those are all different sort of pleasure centers or pleasure or nerves that are sending signals to the brain. And so they may even experience the climax as a little bit different. But ultimately, it's really about each individual person. But like I said, if you're wondering and you're not sure, the clitoris is probably the surefire way to go.
If a woman can't squirt, is she missing out on a like big different type of orgasm as opposed to what she's currently having?
No, it's not going to change your orgasm. You're just going to feel the sensation of fluid coming out, right? You're still going to have the same contraction. So what happens when you climax is your pelvic floors have this very strong contraction, which is part of what feels so good about it, right? You're having this big buildup of tension and then a strong release. And so that's what's happening. And so you're still going to have that. It's just that is fluid coming out or not? And some people find that really exciting and fun. And some people find it like it's a mess, right? But I think ultimately, again, pleasure is the goal.
I have a question for you on this topic. We're spending a little bit too much time on squirting. But I do have a friend who had she learned that she could squirt with a situation with another woman where she was like, I have to go pee. And then the woman was like, just don't pee, just come back. And then she realized, a superpower, right? So is that something common where women feel the need to pee, but that could potentially be that situation where they're just going to squirt?
Yeah, it could be. Absolutely.
Okay.
Absolutely.
All right.
Switching gears here a little bit. When it comes to erectile dysfunction, I've heard, from a lot of people, they say like that Viagra, Cialis doesn't work for them as much anymore. And you were mentioning some of that in the gym. Mm-hmm. So like what's going on there? What's happening there?
Yeah. So let's talk about why ED happens, right? So we can kind of start there. So the number one cause for ED is vascular problems. So problems with blood flow, right? And that happens most commonly in the US because of 3 things: hypertension, diabetes, high cholesterol, right? And high cholesterol is the one where I will see guys like you come into my office and their cholesterol is through the roof, right? So like you can look like the perfect specimen of a man and you can still have high cholesterol. And so I think it's really important to make sure those 3 things are on point. But say you do develop ED and then you start these medications, which are going to help you because they're going to increase blood flow in that time period where you're taking the medication. So they're going to help push blood flow through to the penis. But if your vessels continue to have problems because maybe your blood pressure is not controlled, maybe your cholesterol is still going up or remaining high, or your diabetes is continuing to progress and affecting the health of those blood vessels, then it doesn't, like, you can only push so much, right? If your blood vessels become unhealthy, then you can't keep pushing through them. The medication is going to stop working. It's not that the medication itself is failing, it's that you yourself are having issues with your health that you're not really understanding. Now, there's other causes of ED, right? It's not always blood flow. That's probably the most common, as I mentioned. But a lot of times what I'm seeing more and more, especially with younger guys, is psychogenic ED or performance anxiety, as people describe it, right? They have an issue where usually it starts with one episode, right? They have a problem in the bedroom. They can't get it up. And then they're stressed about it, right? Like, you're thinking about it over and over again. You're with your partner. Like, am I going to be able to have an erection? Is it going to go away? Am I going to let her down? Am I going to let myself down? Is it going to happen? That's all you're thinking. You're not like, hey, I've got this beautiful partner here. I'm going to have a great time with her. You're like, I'm really stressed about this. And so, of course, you're not going to have an erection because you're stressed. And then that just cycles and cycles and cycles until you're like, I'm broken. I can't fix it. I don't know what's going on with me, right? And so then it's like, now you've created this big stressful situation around sex. And so how do we fix that? Very often we will use the help of sex therapists, and they'll do things like tell you to stop having sex and start being intimate with each other in different ways. So start by, it's called sensate focus. So start exploring your body. Don't touch genitals. Don't have penetrative sex. Just find out other areas of the body that are erogenous, enjoy each other. You're not thinking about your erection. You're focused on being with your partner. Then slowly, as you start noticing, like, yeah, I am really focused. I'm really here. I'm really present. Now I'm going to start genital touching. So then you start genital touching. And again, focusing on the task at hand, being with your partner, being present, enjoying the touch, right? And once you finally are like, okay, yeah, I'm not thinking about my erection, then you go back to penetrative sex. And hopefully that will help cure some of those issues. Now, there's a lot more that they can do with you, but that's sort of where you start, and you work through things that are affecting you mentally that can affect your erections. So that's very common. Then there's hormonal, which is low testosterone most commonly, but it's also a very small proportion of men who have ED have low testosterone. It's only like 3 to 6%. So that's usually, I mean, it can be a contributor, but it's not the only cause in only about 3 to 6% of guys. And then neurologic. So if you have certain conditions like multiple sclerosis, Parkinson's disease, spinal cord injuries, that can affect erections. And then, of course, medications. So we commonly see ED from medications like antidepressants, certain high blood pressure medications. Now, that doesn't mean you shouldn't be on high blood pressure medications. It means you just need to switch your blood pressure medications, because thinking back to what I said earlier, if you have high blood pressure, you don't treat it, your ED is just going to get worse.
Don't sometimes the lipid, some of those drugs that help control your lipids, don't they sometimes cause situations of ED?
Well, it depends on which one, but more commonly with the blood pressure medications. And again, you got to figure out how to improve and of course, diet and exercise are first and foremost, right? Like, you got to do those things first, and you won't need to be on medications, right? So improving your diet, improving your exercise are really hard to do, and they take consistency and they take consistent effort. But never give up and keep working at it, because that's going to be the key, right? You don't want to take medications for the rest of your life. You don't want to do those things because, again, they do have side effects. But until you've done those, the medications will help maintain the health of your tissues, right? So I think thinking like, yeah, I'm going to do all these things, but my cholesterol is like 250, 300. No, bring it down and then keep doing those things, and hopefully you'll be able to get off the medications.
Something I want to mention. A few years back, there was a point that I had a lot of work and a lot of training for jiu-jitsu for some stuff I was getting ready for. And I went to have sex with my girlfriend, and my dick didn't work the right way. That shit messed me up because I literally, I was like, oh God, I hope this doesn't happen again. Then it happened again, right? And I was just like, fuck. Then I was like super scared of having sex, because I was like, what's going on? At the time, a lot of training. Wasn't getting a lot of sleep. It really messed me up in the head. But then I was like, okay, let me just try to fix this. Let me start getting sleep. Let me start getting on top of things. And then things started working the way that they should, right? So I just want to mention, it's like, that shit happens. Don't beat yourself up about it. It's all good.
And your calories are a big thing. Your food.
The food, yeah.
So like Nsima and I, we've done like one meal a day. We've done like a lot of fasting. And, if you're doing a lot of that stuff and then you're recognizing that you're having some trouble, start to eat, start to get a lot of food back in. And the way to get lean a lot of times is to cut out a lot of fats and cut out a lot of carbs. That's a way to get totally shredded, but it's a way to lose your dick, basically. So be very cautious with it. And you have to kind of, maybe if it's someone that's going to compete and get on stage, maybe they have to make particular sacrifices at certain periods of time. But just understand that it's these things, they can obviously be like a real bummer. They can really, more than just a bummer, they can make you like depressed.
Yeah.
Well, yeah. And you think about it, you take a lot of pride in the way you look and the way you exercise and you show up. And then this is the thing that's not working. And you're like, what? Like I'm trying to be the best I can be. And now I'm not able to be the best in other areas of my life. So it makes sense. And the other thing is you mentioned, like, if you're not eating enough fats, right? Testosterone is from cholesterol. It's made from the cholesterol pathway. So if you're not eating enough fat, like healthy, good, nutritious fats, your testosterone is going to go down too. So important to maintain a balanced diet and could include some healthy fats.
Are there some other things that work well? Like Viagra, Cialis has been around for a long time. Is there anything new?
So in terms of things, so there are some new things. So just the basic pathways that we use as sort of evidence-based treatments for ED would include medications, which would be Viagra, Cialis, Levitra, Stendra. Those are the medications for ED. They all are PDE5 inhibitors. They work by preventing the breakdown of some enzymes that help you maintain the erection. Then there's intraurethral suppositories, like a little pill you can put in the pee hole. I personally don't prescribe it very often because it doesn't work that much better than the pills. Then there's vacuum erection devices, which help you get an erection by using a vacuum. Like, it forces blood flow into the penis and often used with a constriction band to maintain that blood flow.
Don't just use your Dyson.
Yeah, no. You want to use ideally medical grade devices because they have safety things within them to help prevent you from using too high of a vacuum suction so you don't injure yourself. And then you use them with a constriction band to help maintain that erection. Now, those don't always feel completely normal because they're not all arterial blood flow. They do include venous blood flow. So it might look a little blue, it might feel a little cooler, it might feel a little different, but you still are getting blood flow and you can still get a good erection with it. And it takes practice. I think with those things, it's like, it's not going to work the first time. You're going to have to learn. There is a learning curve. And so you got to be up for the challenge of, using it and trying to figure it out what works for you, because it's going to be individual from person to person. And then there's injections. So there's what's called intracavernosal injections they're really small needles, like insulin needles, that you inject medication directly into the penis. They work really, really well. But it is a mental block of like putting a needle near your penis is really hard for a lot of guys. But they work really, really well. About 80% of guys who are having trouble will be able to get an erection. So those are the on-label options. Now, in terms of off-label newer things, so one is Botox injections. So that's relatively new. There's a few studies on injecting Botox into the penis. And the reason I like this is because they did these studies on guys who were so bad that they were about to get surgery. They were about to get a penile implant because they could not get an erection anymore. The medications were not working. Nothing was working. So they gave these guys Botox. And then they were able to then not have the surgery, about 80, depending on the guy. So 80% of guys with mild ED, 50% of guys with moderate ED, 30% of guys with severe ED were responding, meaning they were then able to take medications or not take any medications and get an erection. So that was pretty impressive data, even though there's only been a few studies. So that's why it's not prime time yet, but I think it's very low risk and has the potential to work. It lasts between 3 to 6 months, depending on the dose you get. The other thing is shockwave therapy. So shockwave therapy, how it works is it's using sound waves. It's going to cause sound waves that create micromechanical traumas to the penile erectile tissue. And then your body sends its own growth factors into the penis to then recreate blood vessels. So it's actually creating new blood vessels in the penis over time. And so that has been shown to be effective in like the 3-month time frame, about 60-70%. And then when you go out to a year, it drops to about 50%. And likely again, because probably there's some ongoing process that caused the ED, right? And it's still going on. So you probably need some maintenance. But that's where I think the data becomes a little murky. We don't have clear maintenance protocols yet. They haven't been really rigorously studied. But we've been looking at this for about 10 years. So there's a lot of data. And I think the issue is that it's been using different machines, different different endpoints. And so we have not yet come to a consensus on like from the AUA, American Urological Association, about is this, should this be part of a treatment plan? But I think it works for the right person. Now, if you're using it for somebody who has really severe vascular ED or ED due to a non-blood flow issue, it's not going to help you. So I think you got to find the right guy, mild to moderate blood flow issues. That's the right guy for Shockwave. And then there are some other things. I think the data is really minimal on those. That includes PRP injections and stem cells. I would say at this point, I would not be convinced. The PRP, there was a really good randomized controlled trial, meaning guys got randomized to either get PRP in their penis or saline, that showed there was no difference in erection quality. And so based on that, and of course, every study has its limitations, so I might be proven wrong later on. But for now, based on that data, I don't recommend it. And then the same thing with stem cell, there's just not enough data.
Question about, because when we've been talking about Viagra and Cialis, we've been mentioning it synonymously, but these two very different effects, especially long-term, correct?
Absolutely. So the difference is when you're taking them, you can take them on demand, and tadalafil or Cialis, you can also take daily, which is like my favorite medication by far. But let me explain the difference. So Viagra has a half-life of about 4 hours. So after about 8 hours, it's pretty much gone from your system. It's going to work the day you take it, and you're going to have sex that day, and then it's going to go away, right? So it's going to help improve blood flow for that short period of time, and it's going to go away. The one side effect with that can be vision changes. That doesn't happen as often with Cialis because PDE5 is also in the eye. And so sometimes people will have blue-green vision discoloration. If that happens, stop it immediately. Don't take any more, okay? It's very rare, but public service announcement. The other one is tadalafil. That works on PDE6. So that one has a longer half-life, meaning it lasts up to 3 days. So you can take it on a Friday and have sex all weekend, right? And also it has, because it's PDE6, it also can have some muscle aches as a side effect, which you won't see with the Viagra or the
And this would be at higher dosages?
It's depending on the dose you take, but that's a known risk with any dose of the tadalafil. Okay. Now, the on-demand, like I said, the tadalafil you can take daily or on-demand. It can be 5, 10, 20 daily, on demand. And then daily is usually a 5 milligram dose. Now, I love daily tadalafil because one, it takes the anxiety out of it, right? Like you take it daily, you don't have to think about it. It's always on board. You always have a little bit of increased blood flow to the genitals, which is good for the health of the genitals. And overall, I mean, we're seeing a lot of uses for it in urology. So we're using it for enlarged prostate because it helps relax the smooth muscle of the prostate. Oh. There's even some data that I was reviewing on like after certain surgeries on the urethra where they're using it and they're seeing good blood flow and better recovery and less recurrence rate. So like there's a lot on there, but there's also in the cardiovascular literature, there shows potentially some cardiovascular benefit, and in the muscular health space, that it may improve blood flow to the muscles. And so I think those are all theoretical benefits, but ultimately I think there's very little risk and a lot of benefit to taking it daily. Especially if you're suffering with ED and difficulty with urination, like kill two birds with one stone, and it can be really, really useful.
Taking the like a scenario that Nsima just explained earlier, a man's working really hard, he's exhausted mentally and physically, goes to have sex, can't get an erection, maybe tries to clean things up, get some better sleep, but then the next time he goes, it's in the back of his head, it happens again, right? It's kind of like a
self-fulfilling prophecy.
Right, it's a snowball effect, right? Yeah. Would he be able to use like ED medications as like a confidence booster short term? Or are ED meds similar to like TRT? Like you take it, you feel great, but then you come off of it and then you probably feel worse than you did initially. Like, is it something that you would just need to do perpetually to maintain that performance?
No. So you don't, to answer your question, no. If you I often do this for guys with psychogenic ED, is I'll give them daily tadalafil. We'll get them feeling confident. We'll get them to the point where they're having great sex, and then we'll slowly taper them off. And it just allows them to like have a little help, right? A little help when they're stressed out. And so that's one way. Sometimes people will then get stressed about going off of it, right? Because like, no, now I need it. That's a whole nother issue, right? So there's two ways to look at it, but I find that if we can help somebody get an erection, feel confident in their erection, then, that's part of it. And then take that and maybe go to sex therapy or talk to someone about it. And then you're probably going to be in great shape, right? So in an ideal world, you do both those things. I think everyone should, if they can, if they have the means and access to a sex therapist, I think you should. And I think you're going to be in good shape.
For years on this podcast, we've been talking about the benefit of barefoot shoes. And these are the shoes I used to use back in like 2017, 2018. My old Metcons. They are flat, but they're not very wide and they're very stiff and they don't move. That's why we've been partnering with and we've been using Vivo barefoot shoes. These are the Modus Strength shoe because not only are they wide, I have wide ass feet and so do we here on the podcast, especially as our feet have gotten stronger, but they're flexible. So when you're doing certain movements, like let's say you're doing jumping or you're doing split squats or you're doing movements where your toes need to flex and move, your feet are able to do that and perform in this shoe, allowing them to get stronger over time. And obviously, they're flexible. So your foot's allowed to be a foot. And when you're doing all types of exercise, your feet will get stronger, improving your ability to move. Andrew, how can they get their hands on these?
Yes, head to vivobarefoot.com/powerproject and enter the code that you see on screen to save 20% off your entire order. Again, that's at vivobarefoot.com/powerproject. Links in the description as well as the podcast show notes.
There's not a lot of women in urology, is there?
No, it's only 11% of women practicing urologists.
How'd you get into it?
Yeah, so I actually didn't even know what urology was. I thought I was going to be a cardiologist. I went to medical school and hated medical medicine. So meaning taking care of patients with long-term chronic conditions and just giving them pills. That was not fun to me. Then I went to surgery and I was like, this is amazing. I love being able to do something physically with my hands and fix a patient and send them out, right? So I was like, oh man, I like surgery, but I didn't love general surgery. I didn't love the personalities. I didn't love the surgeries. And I was like, okay, let's think about the subspecialties within surgery. So there's ophthalmology, which is eye surgery. I went to one surgery and was like, I don't like eyeballs. It's a great specialty, but not for me. And then I looked at ortho, which I'm not into power tools. So that was not for me. And then I went to ENT and urology. And that was sort of my, okay, which one of these is for me? They both are really great, cool surgeries. But when I went into urology, I was like, I love these people. They're really cool. How seriously can you take yourself for dealing with dick all day, right? You're going to be...
Clip that.
That's the one. That's the one.
Yep. You're going to be a fun, jovial person, right? And so generally I find that urologists are my people. They're great. They're fun to be around. And I didn't have a problem, obviously, as you guys can see, talking about things that are really intimate. And so I went for it. And I think a lot of people who are in training, you do things because you kind of have a hunch that it might work for you, but you don't know what it is until you're really into it. And it worked out. I love urology. I love all of urology. I think urology is great. I love taking care of the patients. And I think it's just it's one of we do a lot of cool surgeries. So we do robotic surgery. We do minimally invasive stuff all through the urethra. So and so we can do stuff without even a cut on your body. And we can do minimally invasive stuff in the office. So there's a whole range of things and we get to see our patients over time. So I see my patients all the time. I get a relationship with them. It's not like I just took out their appendix and I'll see you never, right? I get to see you. And so that is really kind of the best of both worlds.
There's so many puns. There's so many.
Oh yeah.
Just leaving yourself wide open for that's what she said, or maybe even a that's what she didn't say.
Yeah. It's great. I mean, you talk to a urologist and you always have a good story.
Why do you think in our society, younger folks are having a lot less sex?
I think there's a lot of factors. One is I think that younger people are interacting with people differently than we did when we were younger, right? They're using devices. You'll see them hanging out and they're all on their phones, interacting with each other through their phones rather than interacting in person. So I think there's that. I think there's a communication issue. How do you approach somebody? That's changed, right? There's you have to, not that this is bad, but you have to ask for permission. You have to, it's very awkward to ask. You don't want to get in trouble. You don't want to. So there's a lot of I don't know how to do this, right? I don't know how to navigate this.
They call it a drone kill in the gym, I guess, is what I've heard.
Yeah, I mean, it's tough. And then I think there's also COVID was a problem, right? We were isolated as people. And so those people who spent a lot of their young years in COVID, isolated at home are struggling, right? access to a lot of other materials now that there weren't, right? So access to pornography is so easy. When we were younger, you had to find a magazine or find a VCR and find a tape, if anyone knows what those are anymore, and and find a room where nobody was, so you could
No
watch
one ever made it
right?
past this part of the tape, which is disturbing. If you think about it, give that some thought. It's like this 7-second segment. No one ever made it past.
But like it was hard, right? You had to work for it. And now it's too easy, right? It's too accessible. And then you're seeing young people seeing this and thinking this is what sex is. And sex education in our country sucks, right? Like you learn the important things of like how to put on a condom, how to ask for consent, and how to avoid pregnancy and STIs. Those are very important things. They give very little time to sex education in school, right? Like they just don't. And so you're not learning what is your body, what's normal. Is it normal to not get an erection sometimes? Yes, it's normal, right? It's normal. It's going to happen. That doesn't mean you're broken, right? That doesn't mean you're never going to have an erection again. And what is it? What does female anatomy look like, right? Like women don't even know their own anatomy. How can you expect a man to know their anatomy, right? So there's such a gap in education. And then they're getting education through pornography. If you look at, they've actually looked at studies of like how are people learning about sex? Very few learn from their parents or from school. It's mostly from pornography.
Jizzhut.com when I was a teen.
But that's harmful, right? Because that's a produced product. It's not meant to emulate real sex. You don't just have fast and furious sex and everybody comes and you're great and it's done. That's not real sex, right? And so I think they then have these expectations of what sex is going to look like, and then it doesn't happen that way, and then they're like, this is awkward. I don't feel good about it. This wasn't great, and like now I have this other thing in my head about sex, right? So I think that's a problem. And there's another interesting fact I'll share with you is that people are now choking or strangulating their partner much more commonly. Did you guys know this? I did not know this until very recently.
Things are a lot more violent in the bedroom.
Yeah. And so like this is as normal as kissing, right? Like this is so normal, and it's like, but are they even really asking for permission? Is this really okay? Are they really liking it? We don't know, right? And they've actually studied this, and they found that the women it's most often women receiving the choking, and they're like, yeah, it's okay. Or no, I don't really like it. Or yeah, sometimes I'm scared. Like there is a variety. Not everyone's like, yeah, that's really hot. And some people can find it really hot, but like it's not what we're thinking it is.
So is the uptick of that, or the uptick of the performance of that because of porn?
We think so. I mean, we can't be sure, but it was not like, think about the things that are available to people on porn now. That was not something we saw growing up. Like, you know what I mean? Like now it's like so wild and crazy, more novel, more exotic, more, out there. And so I think you're just exposed to different things.
I think I saw a segment from Joe Rogan, and he was like, how are they going to figure out this point in history when women completely lost their pubic hair? He's like, how are they going to, people had pubic hair. They got it like at 13 or whatever. He's like, and then this point in time, it just disappeared, like completely disappeared.
But so I think that the other thing is that there's other kinds of porn out there, right? It's usually behind a paywall, but it's more varied. It shows pubic hair. It shows different kinds of vulvas, different kinds of penises, right? And so like, that's great. Like that's fine. And it's more of a story, more of about getting together and actually having sex. And so like, and so that's still very erotic, but it's just not on the free sites, right? And I think that is great to incorporate. In fact, we know that couples who watch porn together, if they both have a good thought about porn, have better sex.
So on these pay sites, you can watch two people that just came home from Costco that didn't take a shower or something like that.
Why does this make me think of like vegans? Like I feel like this is like, for some reason when she was talking about that, it just feels like vegan porn.
It's too organic for you.
I just, you know what I mean? Like
That's great.
But who knows?
Are people
Protein free.
Are people like approaching you, in your opinion, are people like kind of approaching you or approaching medical intervention maybe a little too late? Well, not too late, but like, would you like for people to consider this earlier?
Yeah, I mean, I would love it if people had basic understanding of their bodies, right? So like one of my goals in life at some point is to make a really good sex ed course, right? That's freely available, that people can share with their kids, that people can watch themselves, because I think it's never gonna, like any other way, it's not gonna work, right? Like schools are not gonna implement it. They don't have the time, right? So we got to figure out a way that it makes easier for parents to share with their kids like sex ed. I think that is probably the first and foremost. Then when you're having issues, absolutely people are delayed, right? I like, on these like now we have all these like online telehealth clinics, and for some part of me I'm like, I'm glad there's access, right? Because there's a lot of people who will never come see me because they're just not going to. They're going to be too nervous to see someone in person, and so for that, that's great. But I do worry about like them getting the proper education around the things they're getting, right? And the proper monitoring, right? Because if I just give you Viagra or Cialis, I don't tell you like, hey, your blood pressure and your cholesterol and your diabetes need to be under control, I'm not fixing you, right? I'm just giving you a Band-Aid. And so I think sexual education and issues with sex are a great place to start talking about overall health, to start counseling about diet, start counseling about exercise, and to really introduce that. Because let's be real, if I tell you, you want to have sex for the rest of your life, you want to have great hard erections for the rest of your life, diet and exercise, bring your cholesterol down, you're going to do it. You're going to do it. I'll tell you, these guys who I operate on for penile prostheses or implants, they have to have, at least for me, and everyone's a little different, I make sure their hemoglobin A1C, which is a marker of diabetes, is below 8. So I'll see guys whose hemoglobin A1C is bad, like 9, 10. And I'm like, don't come back until it's below 8, and then we can talk about it. Oh, they come back and they've had a high hemoglobin A1C for years, but they come back within 6 months and they're like, I'm at 7, I'm great. And I'm like, that's all you needed? Like, to get your erections, you're going to change your life? Okay. And so it's really powerful. It's a really powerful tool that we have that we can use and that everyone should think about, right? Let's help future you. Like, let's help future your erections, your sex life, because sex is so important. It's such an easy, free activity that you can do with your partner that's playful, that's fun and pleasurable. And like, let's not forget the benefits of sex, right? And how they can help improve your life.
What are some things to think about with nutrition in terms of people's sexual performance, whether it's male or female? Is there any particular diet that seems to show?
Yeah, so the best studied diet is the Mediterranean diet, right? So that is very low in processed foods, right? No processed foods, lots of fruits and vegetables, some meat, fish, some healthy fats, olive oil, nuts, things like that. But basically what I tell people is avoid as much processed food as you can. Try to make sure you're getting good fiber intake through your diet, you're getting good protein intake through your diet, and that you're getting, a good amount of vegetables too and fruit. Like, I think those are really, really important. And just minimize our processed food. I mean, the issue is that it's everywhere. It's ubiquitous. You can't go anywhere without getting hit by an ad for processed foods. I mean, influencers are making Lunchables and all sorts of things, right? And like, I think, like cook food at home, limit how much fat you're putting in your meals, but just, make sure you're getting a small amount of healthy fats and really like think about your meals. And even if you can start by just changing one meal to be healthier, and do something super easy. That's what I tell all my patients. I'm like, don't go home and be like, I'm going to start meal planning and meal prepping and do 3 meals a day.
Starting on Monday.
It's like, it's never going to work. It's not going to be sustainable, right? You might do it for a month or 2, but there's the rare person who will keep doing it, right? Most people will fall off. So you need to do sustainable, small changes and do them over time. Like, the Atomic Habits book. I'm like, apply that to your food, right? Apply that to your exercise. Make small habits that will make changes over time. We're not talking about changing tomorrow. We're talking about changing for future you. So a year, 2 years, 3 years, I don't care how long it takes you to get there, as long as you're constantly committed and making progress.
And someone just losing like 5 to 10% of their body weight could have huge impact, right?
Absolutely. And, exercising has been shown to be as effective as a Viagra. So if you exercise cardiovascular at least 150 minutes a week, you're going to see improvements in sexual function. Weight loss, exercise, improve your diet. I mean, you won't need Viagra. You'll be fine. You got to really focus in on doing those things and helping yourself improve your overall health. What's good for your penis is good for your heart, is good for your brain. So all the things you see online, good for your heart health, good for your brain health, those are the same things that are good for your penis.
Go ahead.
How about supplementation? Like things like ginseng, panax ginseng, citrulline, arginine, right? What are some good supplements for that?
Yeah, absolutely. So I did a whole review of every supplement that I could think of on my YouTube channel. So if anyone's interested in learning about each individual supplement, you can. But because of that, I can confidently say we don't have a ton of data and we probably never will because people will buy supplements without the data and there's no financial incentive for companies to do more data, right? But in terms of the best data that we have is probably for L-arginine, and L-citrulline is a more bioavailable version of L-arginine. Okay. It's a precursor. So those tend to show the most benefit in terms of improving erectile function. And they're going to improve it because they're improving nitric oxide. And so anything that's going to improve your nitric oxide may have potential benefit because that is the ignition for erections. So when you get aroused, your vessels will release nitric oxide, which is then the ignition that tells your body to start the process of creating an erection. And so if you have more nitric oxide, you're going to be able to get a better erection. And so then, those are the things that I would say can be helpful potentially. But again, I caution everybody, do the basics first. Add supplementation once you've got all those things down, because you can't just take that and assume things are going to get better, right? If your diet sucks and you're not moving your body, then, that's not going to help that much either.
I echo that sentiment. And then I have a question about another supplement.
Sure.
Horny goat weed. We've heard a few people mention this on our podcast before. I actually purchased that. I'm waiting for it to come in. I'm going to see what I feel. But anything on horny goat weed?
Yeah, there's actually shockingly very little data on it. Very little data.
So minimal studies on it.
Minimal studies. Yeah.
Okay.
And so I was not convinced that it really works that well. But, people say it does. But let me remind you that the placebo effect, it is a great name. The placebo effect of any pill, I give you a sugar pill, 40% of guys' erections will get better. Okay. So there's a huge placebo effect. And that's why we always ask for these randomized controlled trials, right? That somebody should be taking a pill and they should be taking, another group should be taking a sugar pill, a matched group, right? That's what a randomized controlled trial is. And until you've seen that data, you can't ever confidently say that something works, because what they'll do is they'll give these pills to 100 guys and say, yeah, their erections are better from beginning to end. But what if I gave them a sugar pill? Would their erections improve the same way? So that's why you always want to compare those.
You mentioned starting out as potentially wanting to be a cardiologist. So much of what we're talking about today seems to be pretty linked to the heart, right?
Yeah, so maybe I am. I'm a cardiologist of the penis and clitoris.
Well, we have another heart down there, so.
A lot of times when the heart...
It's the other brain, too. Yeah. There we go.
You're also a neurologist.
When the heart starts to have some dysfunction, that's when other things can have dysfunction, right? Well,
actually, it's the other way around. So the penis, probably the same in women. But we just don't have a marker of clitoral tumescence. So women can't see that their clitoris gets big and large. So they can't tell when it stops getting big and large, right? And so, but in men, what we find is that when they start developing ED due to vascular issues, blood flow issues, that about 15% of those guys will go on to have a heart attack in 7 years, because that's the first sign. The blood flow to the penis going down is going to be the first sign before blood flow to the heart starts decreasing, because the blood vessels to the penis are about 1 to 2 millimeters and the blood vessels to the heart are about 3 to 4 millimeters. So you're going to block those blood vessels quicker than you will.
And then a smart priority by the body. Because hey, let's stay alive.
Yeah.
Right?
Yeah. Let's shunt our blood flow where it needs to go.
Right.
All right. Down the roller coaster of sex education. Check out this episode right here with Dr. Mohit Khera, also a top urologist. And we got a lot of interesting stuff from him about improving your sexual prowess. Gonna dig it. So click it.